So today's topic is stomach. Now stomach, as we all know, is the widest and most distensible part of the alimentary canal. It is located in the left hypochondriac, umbilical and epigastric region. Now here, in my body, it is placed something like this at this place. Left hypochondriac, epigastric and umbilical regions are the regions which are covered by its location. Now its shape is mostly or roughly J-shaped. Its size and capacity is about 30 ml in the newborn, 1 liters or 1000 ml at puberty, and in adults it is about 1.5 to 2 liters. Now first its external features. Now regarding its external features, it has got two ends. The proximal one is cardiac end, cardiac because it is nearer the heart. This is the cardiac orifice, and this end is in continuation with the lower end of esophagus. The distal end is the pyloric end and is in continuation with the proximal part of duodenum. Then its curvatures. On the right is the concave, shorter, lesser curvature, and it has got attached lesser omentum. In this soft part, this lesser omentum is more clearly visible. This yellow colored curtain light is the lesser omentum, which extends from lesser curvature to the liver. Then the left one, convex, longer border is the greater curvature. In the beginning of greater curvature, separating the greater curvature from the lower end of esophagus is a notch called cardiac notch. Greater curvature has got attached greater omentum. Here you can see this is the greater omentum attached on the greater curvature, along with gastrosplenic and gastrophrenic ligaments. Here you can see this is the attached gastrosplenic ligament on the greater curvature, and this is the location of gastrophrenic ligament. This is how lesser omentum is attached on the lesser curvature and greater omentum on the greater curvature. Now we come to its surfaces. It has got a antero-superior surface and a posterior-inferior surface. Antero-superior because it faces anteriorly and superiorly. Posterior-inferior because it faces posteriorly and downwards. Now we come to its parts. It has got 4 parts. First one is cardiac part or cardia, which is the area surrounding the lower end of or cardiac orifice. Then is the fundus, which is, if we draw an imaginary horizontal line from the cardiac notch, then the part of his stomach above this imaginary horizontal line is the fundus. Beyond that, that is distal to it, is the body, and the distal most roughly funnel shaped part is the pyloric part. Now this pyloric part again is divided into 3 parts. This proximal expanded portion of this rough funnel shaped pyloric part is the pyloric antrum. This tubular canal shaped structure is pyloric canal, and this hard structure in the pyloric canal is the pyloric sphincter or pylorus. Regarding sphincters, at the cardiac orifice, the sphincter is physiological. That is, no anatomically discernible structure of any sphincter can be seen here, but this part acts as a sphincter and you cannot feel it by palpating it. On the other hand, at the pyloric end, you can feel the sphincter because anatomically discernible sphincteric structures are present here. That is, it is formed by the thickening of circular muscle fibers assisted by longitudinal fibers. So an anatomical sphincter is present at the pyloric end, and a physiological sphincter is present at the cardiac end. Now we come to its relations. Regarding relations, the peritoneal relations I have just told you, that is lesser momentum attached at lesser curvature, greater momentum, gastrophrenic and gastrosplenic ligament at greater curvature. Now regarding its visceral relations may, it is related to, first this area is related to the liver, then this area is related to the diaphragm, and this area is related to the abdominal wall. Now, the most important of the relations are the posterior relations. Now, regarding posterior relations of stomach, there is a concept of what you call stomach bed. Now, what is stomach bed? Stomach bed is all the structures located on the posterior abdominal wall that come in the posterior relations of stomach are collectively called as stomach bed. Now, what are these structures? Now, to understand it better, see this diagram. These are diaphragm, left kidney, left suprarenal gland, pancreas, transverse mesocolon, left colic flexure, splenic artery, and spleen. Now, the point to be appreciated here is that all these structures are separated from the stomach by the lesser sac, except the spleen, which is separated from the stomach by the greater sac. Now we come to the interior of the stomach. Now regarding interior of the stomach, 3 points are worth noticing. First is the mucosa on the inside. Here you can see the inside of the stomach is thrown into irregular folds called gastric rugae, R-U-G-A-E. These are irregular mucosal folds into which the gastric mucosa on the inside of the stomach is thrown into. Then it has got interspersed small depressions called gastric pits into which the gastric glands open. And the third one is the gastric canal of Magenstrasse, M-A-G-E-N-S-T-R-A-S-S-E. Now this is a temporary structure which is formed during swallowing along the lesser curvature and helps in easy passage of swallowed liquids along the lesser curvature. Now we come to its arterial supply. Now regarding arterial supply, the 5 different branches and sub-branches of celiac trunk supply the stomach. Celiac trunk, because the stomach is a part of foregut and celiac trunk is the artery of foregut. First is left gastric artery along the proximal part of lesser curvature. Then there is the right gastric artery along the distal part of lesser curvature. Then left gastroepiploic artery along the proximal part of greater curvature, and right gastroepiploic artery along the distal part of greater curvature. Now this left gastric artery is a direct branch of celiac trunk. Left gastroepiploic artery is a branch of splenic artery, which in turn is the branch of celiac trunk. Then right gastric artery is a branch of common hepatic artery, which in turn is the branch of celiac trunk. And right gastroepiploic artery is a branch of gastroduodenal artery, which in turn is the branch of common hepatic artery, and which is the branch of celiac trunk. Now this was the arterial supply of stomach. Just take a look at this diagram which shows the arterial supply of stomach. Here is the left gastroepiploic, right gastroepiploic, left gastric and right gastric artery, and this is the location of celiac trunk. Now regarding its lymphatic drainage, all these arteries I have just named have their corresponding veins. That is left gastric vein, right gastric vein, left gastroepiploic and right gastroepiploic vein. Now regarding its lymphatic drainage, this can be understood by the help of this diagram. Now we divide the stomach into 4 areas in this way. Area 1, 2, 3 and 4. Now area number 3 drains into pancreatico-splenic nodes, area 2 into right gastroepiploic nodes, area 1 into left gastric nodes, area 4 into right gastric nodes, and all these nodes ultimately drain into the celiac nodes. Now this was the lymphatic drainage of stomach. Now this lymphatic drainage of stomach is very important in cases of malignancies of stomach, that is CA stomach, because through the thoracic duct CA stomach metastasizes to left supraclavicular lymph nodes. Now left supraclavicular lymph nodes are also known as Virchow's nodes, VIRCHOW''S, and this enlargement of Virchow's nodes or left supraclavicular lymph nodes is the first sign of gastric cancer, which is known as Troisier's sign, TROISIER''S. Now regarding its nerve supply, the stomach is supplied by T6 to T10, which constitutes its sympathetic supply, and parasympathetic innervation is by vagus. Now vagus has got three branches: hepatic, celiac and gastric. Of our concern regarding today's topic is the gastric branch, which is known as nerve of Latarjet, LATARJET. Now here you can see this is the nerve of Latarjet of the gastric branch. Actually gastric branch has got a nerve of Latarjet on both the surfaces, anterior superior as well as posterior inferior surface. Now this is important, this nerve is important because this nerve supplies the acid and pepsin secreting areas of the stomach. So in patients of hyperacidity or recurrent peptic ulcer, where you have to reduce the secretion of acid, a surgical procedure called vagotomy is undertaken, where we cut this nerve, that is the nerve of Latarjet, in order to reduce the incidence of CA stomach or recurrent peptic ulcers. So that was all about today's class. Thank you.